Hello, my name is Ellen Thompson, and my topic is muscle deterioration in the fruit fly model of tumor-induced cachexia. Cachexia is also known as wasting syndrome. It is a disorder commonly seen in patients with late-stage cancer or other terminal illnesses. In cachexia, you're going to see a progressive loss of muscle proteins. You're going to see the decrease in the production of these proteins, and you're also going to see increased cell death. You're also going to see in the fat the loss of traditional white adipose tissue. And you're also going to see a change from itself to brown fat. And overall, you're going to see the increased breakdown of fat tissues. You're also going to see more changes in the individual with a lack of appetite, intense weight loss, unnatural hormone levels, anemia, anorexia. You can also see increased metabolism. Other parts of the body are also affected. You can have changes in the pancreas, immune system, bone structure, liver, and gastrointestinal tract. To understand the mechanism behind these changes, we use the model organism Drosophila melanogaster, commonly known as the fruit fly. In this species, we have developed a tumor model. As you can see here, we have chromosome 1, chromosome 2, and chromosome 3. When this stalk is crossed with anything, you can see that the GFP positive larva develop tumors. This is going to be in the tracheal area of the larva. This is going to develop in the posterior hinds of the legs, wings, and antennal imaginal discs. With these tumors, they're going to have late development, and they're never going to pupate. And they also show common symptoms of cachexia. With our tumors, they're going to grow bigger than our regular wild-type CANS. You can see that there is going to be thinning here. You can see that it's more transparent compared to our CANS. This is due to the progressive loss of muscles and fat. It's also going to lose movement and it's going to show rigidness. Our affected larvae usually die between days 12 to 14, and our heavy myosin chains are going to be stained in red, and our tumor is going to be stained in green. The reason behind my research is because when we looked at our larvae in our later stages, you can see that our day 8s, day 10s, and day 12s from our tumors weren't as fluid with their movements as our day 5 wild-type CANS. So to see if their wasting was due to not being able to eat, we decided to do a pre-experiment to see if our larvae could take in the needed nutrients to survive and to move and do everything they need to do. So I timed various larvae between CANS and our tumor stalks to see how long it would take them to complete 25 full movements with their eating. And it's seen here that our tumor to day 8s and our CANS day 5s are not significantly different. However, our day 10s and our day 12s are. You can see that it takes progressively longer for our day 12s and our day 10s to eat to do 25 full movements compared to our CANS. And you can also physically see that the day 12s were more rigid. They did not move and they cannot fully do everything, and they would usually stutter when they tried to do a complete full eating movement. Here is a simple cartoon of the muscle fibers we're going to be looking at. You can see our alpha actinin up here at the top, and then our actin, and then our heavy myosin chains right here. This is going to be our top part, and this is going to be our bottom, and this will be easier to understand our muscle dissections later on. In our muscle controls, we're going to use CANS, as I stated before. This is our wild type. They usually leave the food around day 5, so this is where we collect and dissect them. So we stained our alpha actinin with green proteins, and our red is going to be our actin. As you can see here, our alpha actinin is very straight. There's no gaps, no differentiating gaps between our alpha actinin. You can see that it's just very smooth and everything over it. It has a very defined, consistent pattern between itself. But when we move on to our day 8s, you can see that the fibers are not straight across. They have a little bit of jaggedness to it. And you can also see that in between the defined green lines, you can see that there's other parts of green where the actin is. So we would call this the smoothing of the muscles, and you can also see it here, right down here where the other yellow asterisk is. The pattern is relatively the same between day 8s of the tumor and can't nest day 5s. However, there's only minor detectable differences. With our day 10s, you can see that the muscle fibers are stretching, that they're becoming a little bit thinner. The lines are more jagged, they're not straight across anymore. You can also see more defined that the alpha actinin is going to be within the actin. And you can see it mainly here, the stretching of the fibers, and you can see it here, how the green spreads into the red with this yellow asterisk down here. And you can also see early detection of tears. You're going to see it starting right here, and you're also going to see one starting right here. With our day 12s, you're going to see a dramatic difference between the cantoness and on our tumor. You can see here with the yellow asterisk also thinning. You can also see it up here. It's more defined how there's jaggedness and how the green is going between the red. You can also see areas where there is only one present. Here we only have the actin, but over here we only have the alpha actinin. Also up here, you can see very big tears and thinning, and even here you have very defined snaps within the muscle. In the tumor model, the progressive loss of muscle is detailed. Over time, the muscles are lost and their structure is dramatically changed. You can see that the fibers become weak and there are bigger gaps between the attachment of the muscles to the skin. You can see in the cantoness, they're very close and defined, while over here you see big giant gaps in the background where they should be more muscle fibers connecting to the skin. And at the later stages, you can see defined tears and rips and thinning, and is more dramatic compared to our just regular cantoness. This shows that the muscle fibers are weakening over time due to cachexia and that the degradation of muscles is present. So given the results, will cachexia act the same in mammalian models? And if the muscles degrade this far, would the number of dead cells correspond to the loss of muscle seen? I would also like to do my acknowledgments. Thank you to Eureka and Roland Black Endowed Assistant Professorship that was rewarded to Dr. Atkins that funded my research. Thank you for listening to my presentation.